Welcome, everybody. Welcome to the special third birthday webinar of the Newborn Toolkit. Today, we're announcing our essay winners. Welcome. Next slide, please. All right. Welcome once again. The Newborn Toolkit is a multi-country, multilingual learning community for high-quality small and sick newborn care. And the whole goal of the Newborn Toolkit is to move faster together. This week is World Prematurity Week, and we have this special webinar planned to commemorate that and to also highlight the impactful work that our essay winners are doing in the country context. As we know, we have an SDG 3.2 for newborn survival, and that cannot be met without small sick newborn. All our implementers inputting into the newborn tool. We have more than 1,000 tools in 15 languages, technical content in French, and linked communities of practice. Next slide, please.
Right. Hello, everybody, and welcome to our third birthday webinar. We're 3 years old, and when you're 3 years old, we all remember you can ride a bicycle, but there are other developmental milestones. You start enjoying spending time with your friends. You start asking why repeatedly, and you even believe, at least, that you can start to solve problems. So we have come of an age, and it is so exciting to be here today, to be sharing these essays again. And we had so many different entries this year, but there can only be so many winners, and it's going to be exciting to share with you the winners. Today, also hosting with me is my friend Olufunke Bolaji up in Nigeria. Good afternoon, Olufunke. And that's a good afternoon from Olufunke. I'm going to hand over to Lauren, who's going to explain to us some of the upcoming webinars in French.
Perfect. Thank you, Alex. So the Newborn Toolkit has several upcoming webinars. So on November 26th, we have a webinar that will be led in French, where we are getting the French community together and sharing some exciting updates ongoing. And you'll have the opportunity to have a more conversational and share feedback at this event. And then on the 3rd of December, we're launching a new tool on the Newborn Toolkit and focusing on implementation, research, and equity. So we invite you to join these webinar events. The links can be found on our website. Next slide, please. Et bienvenue à tous les participants parlant français. Si tu veux écouter le webinaire en français, s'il vous plaît, cliquez sur le bouton de traduction affiché en bas de l'écran. Et on a aussi quelques événements à venir. Un événement sur le 26 novembre, où on annonce les gagnants de concours et les principales mises à jour. Et le 3 décembre, où on partage un nouveau outil, cartographie et combler les lacunes de la recherche néonatale, recherche de la mise en œuvre et l'équité. Next slide, please. So you briefly heard from one of our hosts, Dr. Alex Stevenson. He is the president of the African Neonatal Association, a Zimbabwean neonatologist, and the co-PI of the African Neonatal Network. And our co-host, Dr. Olufunke Bolaji, she is the chair of the Advocacy of the African Neonatal Association, a Nigerian pediatrician, and the neonatal unit head at the Federal Teaching Hospital of Edo Ekiti. So I'm very excited to have both of these fabulous hosts here with us today, and they will lead us through the webinar and our essay winners. I'll just hand back to Alex and Olufunke.
Thank you very much, Lauren. Good afternoon, Olafunke. I hope you're off mute now.
Yes, I'm right here. Thank you, Alex. So exciting to be here together to celebrate our 3 years old birthday. Great.
3, and that's you and I wear many hats, my dear old friend, but today we're wearing our newborn toolkit hat because
Absolutely.
the African Neonatal Association is delighted to partner with NEST 360 and UNICEF for this amazing resource. If there are people on the call today who have not looked at the newborn toolkit, I highly recommend you do. It is a curated resource, incredible resource of neonatal resources suitable for low-income settings. And we can see in that wonderful graphic going around and around what is at the very center of humanity, of our society, and indeed of the newborn toolkit. It's family-centered care, and that is what we're discussing today. Okay, next slide, please. Right. What are we talking about today? We're just going to briefly go through this. Olafunke, I think I'm stealing your thunder. I'm going to hand over to you.
Thank you very much, Alex. So as we celebrate our 3 years of being on Earth, we go on to talk about the user update and the website update, which Toby will be giving us as we progress. Lauren will give us some updates on the content. And then right after that will be Mbozu, who will tell us about community engagement. And then what we've all been waiting for, who are the winners for this year's essay? Alex, I'm so looking forward to this, meeting our winners, getting to hear what they talked about and how they emerged as the winners of this year's contest. After that, Professor Joy Lon will be here to tell us what's next. What are we looking at for the next year? What are our plans? What are our objectives? And then we will have some one-on-one with the essay winners today before we close. It looks like a really packed session, and I'm so looking forward to it. Next slide, please. So as we celebrate, we would also look at our milestones. Right after this slide, we'll be seeing a video that takes us through once again how to access the toolkit, the different sections, and the special features that we really want us to celebrate as we look more into our toolkit and we develop it. So I think after this slide, we would see the video. Can we have the video?
Faster together, implementing for small and sick newborn care everywhere. This video is about how you can use, join, and help improve the newborn toolkit. Every year, 2.3 million newborns die because millions of vulnerable newborns don't get the care they need, and they need it fast. Vulnerable babies can die in minutes. To go faster, to reach every newborn and every family everywhere, we need to share evidence-based tools and learn faster together. The Implementation Toolkit for Small and Sick Newborn Care, or the Newborn Toolkit, is a one-stop site to share content on evidence-based tools and build a learning community so that we don't waste time reinventing tools and can go faster together. Who is the Newborn Toolkit for? The Newborn Toolkit was co-designed with and for those involved in small and sick newborn care from every region around the world, including parents and parent groups who are the most important and at the heart of small and sick newborn care, health workers such as doctors, nurses, neonatologists, and other relevant clinicians, biomedical engineers, technicians, and innovators, policymakers and program managers at sub-national, national, and international level, international agencies and NGOs, academics and educators, and funding institutions and donors. Users come from 170 countries with more than 50,000 in the most recent year and growing all the time. Please join us to use and share and go faster together. We're intentionally working to close language gaps with tools available in 15 different languages. The Newborn Toolkit's web content is currently available in 2 languages, English and French, which you can access via the language selection menu at the top of your screen. Our ambition is to include other languages, and we welcome ideas and partnerships for this. How can you use the Newborn Toolkit content and access a learning community? Based on listening and co-design, the Newborn Toolkit provides different levels of use, including specific tools that you can access and adapt to your context. Examples include neonatal unit floor plans, education materials, medical device planning and costing tools, as well as data tools such as health facility assessments, systemic planning for scale-up. One example of this would be developing an investment case, including infrastructure planning, human resources, medical devices, and improving information systems, community opportunities to share implementation learning. Together, we host regular multilingual webinars with speakers sharing learnings from all over the world. We also have regular news articles, blogs, plus exciting podcasts. To provide effective small and sick newborn care, we need more than one intervention. The World Health Organization has listed priority interventions for level 2 care. If these interventions were provided with high quality to every newborn, an estimated 750,000 lives could be saved per year. The content hosted on the Newborn Toolkit is based on this evidence and aligns to relevant WHO recommendations and guidelines. Implementing at scale requires systems change. The WHO and UNICEF have codified 10 core components as shown in this table. For the toolkit, we have co-designed a wheel that shows the interlinkages between them. Family-centered care, which is at the heart of all small and sick newborn care. Leadership and governance to plan and implement change. Financing and the investment needed. Infrastructure to give the right space. Human resources for the right people and the right numbers. Equipment and commodities so the right devices and drugs are available. Data systems to drive higher coverage and inform quality improvement. Linkages to maternal care, post-discharge follow-up with links to referral system. We have added infection prevention and control based on the data and feedback from implementers, since infections are a major risk in newborn care units and require specific innovations and actions. Linkages to maternal care and post-discharge follow-up are nested in the family-centered care section, while referral systems is nested in the infrastructure section. Together, these health system building blocks and linkages across the continuum of care form the core components that define the structure of the Newborn Toolkit. As we dig into each core component, there is a wealth of information. Once you click on these sub-component headings, content is carefully organized into overview text summaries of what needs to be implemented with cross-linkages to key resources, readings including policy documents, WHO reports, academic papers, and other related resources, tools that can be used to put implementation into action, and learnings from implementers across different countries detailing real experiences of what has and hasn't worked. The Newborn Toolkit is for two-way sharing. Take a look for yourself and see what you can learn about the realities of implementing small and sick newborn care. Think we're missing something? Join us and share your tools, learnings, and news. The What's New section showcases relevant news, important papers, blogs, and opportunities like competitions. Think we haven't covered an important story? You can submit your own using our submission form located on the top menu bar here. The events section lists upcoming editions of our flagship webinar series, which follow the 10 core components, profiling groundbreaking innovations and new evidence. Webinar speakers include a mix of disciplines and organizations from around the world. We cover very practical topics like how to manage power outages or increase the number of neonatal nurses or detect infection outbreaks. The previous webinar tab allows you to access recordings and slide decks from all our past events, ensuring you never miss out and can share with others. In the Learning Hub, you can find essential learning materials from around the world, including in humanitarian and fragile settings. A recent addition is a research funding map showing over 1,000 studies in 78 countries to enable partnering and accountability for more equitable funding flows. The community section highlights some partnerships between the Newborn Toolkit and other key organizations working to improve small and sick newborn care. Please sign up to our monthly newsletter and socials by scanning the QR codes on your screen. If you also create an account by clicking on the Join Us button in the top menu bar, you can bookmark your favorite resources for quick and easy access and access the newsletter archive. We are confident that everyone involved in small and sick newborn care will find something useful on the Newborn Toolkit. But don't just take our word for it. Thank you. Let's go faster together.
I loved that video. Faster together. We totally need to all log on to this toolkit if we want to achieve the SDG goals by moving faster and learning together. So for the next section, I'll be introducing Toby, who will be taking us through the different developments that we've seen on the Newborn Toolkit over the past year. Toby, over to you. Thank you.
Thank you very much, Olafunke. Hello, everyone. It's nice to be with you all on this webinar today, celebrating the Toolkit's third birthday and, of course, the winners of our 2024 essay competition. So if you are a member of our expert advisory team, or if you've seen me present on the Newborn Toolkit before, you'll be very familiar with this line graph by now. It depicts the monthly user count of the Newborn Toolkit since its launch in November 2021, World Prematurity Day 2021. As you can see, we had a very slow and steady first year in existence, accumulating just over 10,000 users in 2022. Last year, the user count gradually increased and then shot up around World Prematurity Day last year. In conjunction with our inaugural essay competition, there was a slight dip at the beginning of this year while people, away for the holidays at Christmas, things like that. But the trajectory since around February of this year has just been one of continual growth. We've seen more and more users. Not only have we seen more users, we've seen higher engagement rates, which means people are meaningfully engaging with the website, finding the resources they need. It indicates that, it's doing what we want the toolkit to do, to be a global good and to disseminate information on small and sick newborn care. But I'd like to emphasize that isn't just the work that we do at the Newborn Toolkit team. The only reason that the Newborn Toolkit is as widely used as it is thanks to all of you, sharing it widely, attending our webinars, accessing the resources, and sharing information on the site with your networks. So thank you very much. I will now pass on to Lauren Allison, who is a co-knowledge management lead for the Newborn Toolkit website. She's trained as a neonatal nurse in Canada and also leads our French community of practice. So Lauren will be taking us through key achievements across the Newborn Toolkit community over this year. Over to you, Lauren.
Thank you so much, Toby. Very, very exciting, as Toby mentioned. Within the past year, so October 2023 to 2024, we've grown to over 55,000 unique users from 170 countries. And that's a big thank you to the community who continues to provide feedback and use the site and engage with the content. So we're very happy to see that kind of continued growth and use. We've also rose to close to over 1,000 tools, and this is now available in 15 different languages. This past year, we've had 12 webinars with over 3,000 total viewers, including webinars and a first Spanish-led webinars. We're also eager to do other languages in the coming years. So if you are interested in Portuguese or other languages, please do reach out to us. We've had a few Newborn Toolkit platform updates, which I'll touch on briefly in the next slide. We've attended various global events within the Newborn Toolkit community. My fantastic colleague has also supported the launch of the Global Neonatal podcast and the upcoming launch of the research funding map, which we'll also discuss as well. Next slide. So earlier this year, we updated the content on the site and we added a referral system section. So this section on content linked to transfer of the newborn. So that's maternal transfer, infant transfer, and then the neonatal transfer system more broadly, looking at infrastructure for referral, what sort of facilities, transportation, staff, and communication infrastructure, and then quality standards and statements for referral. Next slide. Similarly, we also added linkages to maternal care section, and this also touches on various aspects of maternal care that's related to newborn health. So looking at pregnancy and antenatal care, every birth and safe transition, high-risk pregnancy, including preterm births, and then also maternal mental health. So within these sections, there also is a lot of new resources that have been added. So we encourage you to access these on the Newborn Toolkit site. It can be easily accessible through using the cog on the website and to use and engage the content. And we also welcome any additions in terms of tools or areas that you think you would like to have developed further. Next slide. And a big milestone for us last year was the launch of the Newborn Toolkit in French. And this was launched at the International Maternal Newborn Health Conference in South Africa. And in large support with the Chiesi Foundation. This has continued to grow over the last 2 years. So we have over 200 resources and tools in French, over 12 webinars with live translation in French, including the one you're watching today, 2 French-led webinars, and all the content in the health system core components on the site is also available in French. So this is really key to help kind of speed up progress for tackling newborn mortality in French-speaking contexts. Next slide. And I'll now pass over to my colleague, Dr. Ngozi Sapalo. She's a clinician in neonatal health and the co-knowledge management lead for the Newborn Toolkit. She'll discuss more of the community events.
Thank you so much, Lauren, and great to see all the progress so far with the Newborn Toolkit. Just want to share these amazing new ways to look at the Newborn Toolkit that we learned from our implementers. So Rob Bartilia, Nest 360 QR lead, defined the toolkit as a supermarket for small and sick newborn care resources. And Dr. Sandeni defined the toolkit as bits and pieces for what you need to make newborn care work. We invite implementers from all over the world to make use of the toolkit and define it for yourselves. Next slide, please. So we've had webinars this year with many of our partners, and we just want to say a big thank you to all our partners that were involved with making the Newborn Toolkit what it is. We've had webinars with many neonatal leaders from all over the world, and we just want to say thank you, and we're looking forward to working with you again in 2025 and onwards. Next slide, please. The Newborn Toolkit was at global community events, such as the European Academy of Pediatric Societies and the Tiny Feet, Big Steps conference in Tanzania. And in addition to that, the Newborn Toolkit was also in Senegal for a very impactful session that was led by Lauren Allison. And this is all to say that the Newborn Toolkit is meant to link communities and link neonatal groups working in their respective fields. And we just want to continue this momentum in the year coming forward. Next slide, please. So the reason for this meeting is really to explore the essay winners and what they have done in their settings. We just want to say a big thank you to the Chiesi Foundation for funding this amazing way to elevate the work of grassroots implementers, and of course the African Neonatal Association for inputting into this amazing way to highlight the work of different neonatal workers. Last year we had winners from Zambia and Burundi, and this year we're excited to showcase the work of more neonatal health workers. And we will profile these winners on the Newborn Toolkit, and they will guest spot on the Global Neonatal Podcast, and we just hope to elevate their work further. Next slide, please. So to touch on the Global Neonatal Podcast, storytelling is the oldest form of education, and we invite neonatal workers from all over the world to reach out to us and tell your stories and share your learnings to promote the impactful work you're doing in your setting and inspire connections globally. We have many people who have been part of our podcast, and they have had really good connections made through the podcast, and we hope to highlight the work of the essay winners through this podcast as well. Next slide, please. So this is just a few of the amazing people that have been part of the podcast this year. And we just ask that more people reach out to us to profile their work so we can better link together and move faster together. And now I'll hand over to Alex and Olufunke to move us through this exciting webinar. Thank you.
Fantastic, Ngozi, and well done. You are the one. I know families are at the center of our society, but you are the one who is at the center of the toolkit. And thank you so much for keeping it all together. Right, Olufunke, I think that's about it. Time for me to go and just with everything that we were supposed to do, yes?
Yes.
Anything outstanding? Oh, one minor little issue. We need to announce these winners. So 2 winners, the instructions said, 2 winners in total, and it turned out that 2 was not enough. There were so many, such good submissions to us. When we had our judges meeting, we were just going round and round and round in circles, and eventually we just had to say, this year, 2024, there are 3 winners. And so I am going to announce the first winner. Tasmin Bota from the Republic of South Africa, the founder and executive director of Premie Connect and the parent representative for Global Alliance in Newborn Care. And what I really hope we get time to hear from Tasmin to put across her thesis, and just to remind everybody that these winning submissions are going to be published in our Journal of African Neonatology, so people will be able to see them there in 2 languages. But Tasmin, fantastic, well done. And over to you, Olufunke. Are there any more winners, or are we done here?
Yes, there are more winners. And the beauty of this year is the winners have brought the diversity of the ANA into the show. So last year we had 2 winners from 1 country, but this year the winners are spread across many countries. And the next country that featured as a winner is all the way to Burundi. Israel was our winner from Burundi, and is a nurse at Hospital Regional de Ngozi, Burundi. So Israel, Yamuremye. Happy to have you here. Happy to announce you as a winner. Congratulations. We are so delighted for you. Congrats. Alex, are you going to tell us about the third winner?
Félicitations. And where's it going to be? Is it going to be Nigeria? Is it going to be Kenya? Is it going to be Tanzania? Is it going to be Sudan? Is it going to be the Gambia or Eswatini? No, it's not going to be any of those. It's Ghana! And I think they got most of Ghana in the photo here. And I'm told that isn't even the whole team. So an incredible submission from HoeHoe Municipality, Ghana, and this team of Ntow, Banga, and Gbadago, but with such an inclusive and wonderful team, and it really came across in the submission that I hope people will be able to hear about and also read in our paper. So 2024, Ghana, South Africa, and Burundi take the prizes. Well done, everyone. That's fantastic. Makorokoto.
Congratulations to all our winners. So for our next slide, I think we get to see a little bit of some video from them. Tasmin, Israel, and Christina. Do we have the video up now?
It's coming, yeah.
Hello everyone,
Great.
My name is Tasmin Bota and I am from South Africa. I am the founder and executive director of Premie Connect. But most importantly, I am a Premie mom. When I saw what the competition and the essay was about, I knew that I could not sit back without providing my unique perspective of not only being a Premie parent, but also that of the founder of our organization. The question how families can be at the center of all components of health systems change for small and sick newborn care is one that I think it is so very important. In my essay, I share my journey of how our neonatal team recognized the importance of having us involved from beginning to the end of our baby's care. And that made a world of difference, not only to his outcomes in the NICU, but life after. I am so excited for you to see how I have addressed these issues, how important it is for families to not only be involved in the care of their small sick newborn kids, but to understand in layman's terms what it takes, not only inside the NICU, but after the NICU as well. Because the truth of the matter is we discharge these small and sick newborns into communities that know nothing and understand nothing about what is going on with their health outcomes. And it is our duty in hospital to ensure that our parents are best equipped, as they are the ones who are going to be taking care of these tiny babies for years to come. Thank you so much for this honor.
Thank you, Tasmin. And next is Israel, who will be, I expect, talking in French, but the translation is available.
Bonjour à tout le monde, je m'appelle Yamuremye Israël, je suis infirmier à l'hôpital de 3e référence de Ngozi, Burundi, dans le service de néonatologie depuis septembre 2015. Je m'occupe de la visite des nouveau-nés physiologiques avant la sortie et je fais partie de l'équipe des infirmiers affectés à l'unité Kangourou. À côté de ça, je m'occupe du suivi des cardiopathiques opérés à Khartoum par Emergency. J'ai décidé de participer au concours pour partager avec les autres des idées simples mais qui peuvent améliorer la qualité de vie des nouveau-nés prématurés de petite taille et malades, mettant la famille au centre. Le sujet de mon essai est l'éducation, première forme du changement. En prenant l'exemple de notre hôpital, beaucoup de choses ont été réalisées pour mettre la famille au centre des soins de nouveau-nés. Mais c'est toujours insuffisant. Il y a beaucoup de choses à faire. Par exemple, conscientiser les parents sur leur rôle dans la prise en charge de leurs nouveau-nés et ne pas les considérer comme des spectateurs. Les familles peuvent avoir devant elles la néonatologie la plus équipée, belle, propre, fonctionnelle du monde, mais sans la conscience de pouvoir choisir pour les soins de leur nouveau-né ou sans avoir des instruments nécessaires pour le faire. Les soins centrés sur la famille seront toujours sans poids, ni force, ni impact. Ma proposition est alors de trouver du temps pendant les activités dans le service pour parler avec les parents de nouveau-nés, les écouter et les renseigner sur des aspects de vie du nouveau-né. Merci. Bonjour.
Merci, Israel. And last up from Ghana,
we are researchers and health professionals who are passionate about small and sick newborn care. Our team comprises of maternal and newborn specialists, epidemiologists, family systems care experts from Ghana and Switzerland, midwives and nurses who work in maternal and newborn units in hospitals and at primary care facilities. Why we applied for this contest? Our research, which started in 2016, focuses on families across the maternal and newborn healthcare continuum, fits the topic of the AC. Also, we believe in mutual learning and sharing ideas for change. Above all, the Newborn Toolkit is a great learning tool for people who are passionate about small and sick newborn care. Our essay focuses on systems approach. We all live in systems such as the family, health, and social systems, and families are key actors and should be placed at the heart of health system change, which is the reason for family system approach. Illness is a family matter, and we focus on how we can use the resources of the families to support them when they go through challenges and illness across the care continuum, from pregnancy, labor, and postnatal care at the hospital or home. Secondly, it strengthens the families, improves well-being or health of the small and sick newborn and their families. Our next step is to further implement and test our family system care program. We are honored to have won the essay contest. This will help increase the program's visibility, advancing our goal for making family system care more accessible across the region. Thank you.
fantastic and well done to that team from Ghana. And I also have to say thank you very much to our judges. We had a whole team of judges, of families, of parents, of course, EFCNI, and of course, Tukiezi Foundation, who are our very generous sponsors of this project this year and last year. And without them, there wouldn't have been anything. So thanks to all those people, but absolutely congratulations to our winners, and also congratulations to the many, many entrants. I can tell you our meeting with the judges just went on and on and on because it was very hard to choose the winners, and you know, every entrant had many, many good qualities to it. Right, I am going to hand over to a lady who, if you don't know, you should know, Professor Joy Lawn. I'm now realizing that I should, Joy, have a whole list about your amazing qualities, but quite frankly, if people don't know them by now, I don't know what we can do about it. Joy is amazing. Joy is my friend. Joy is going on this journey with us together and faster. Thank you, Joy.
Thank you, Alex. And Alex, what a great talk show host you are. Thank you to you and Olafunke, and most of all, huge congratulations to these three fantastic winners. I'm speaking to you from Kampala. I hope my internet will hold up. And if we go to the next slide, I have a really exciting job just to briefly highlight our goals. I feel like we might be in an Africa Cup of Nations announcements, but the goals for 2025, as Mbozo said at the beginning, we're really coming up to our target of 2030. We have the first ever global goal for neonatal survival, and yet we're so off track. And our hope and our dream here on the Toolkit community with all of us together is that we do go faster together. We shouldn't be starting from scratch on education tools or on data tools. There are floor plans and many other things that you can find here, now more than 1,000 in 15 languages. So over the next year, our goal is together to hear from you on tools that are helpful and to continue to share those. But another thing we've heard from everybody is that we know we need systems change. We heard that beautifully from the team from HoeHoe in Ghana. But we also know that systems change can feel complicated. So how can we make that complexity doable? Learning from each other and finding ways to keep families at the heart of this toolkit. So one of the things that we're doing over the next year is working on user action pathways, and I'll come to more on that in a second. During next year, we'll also have 10 webinars on the small and sick newborn care 10 core components from WHO and UNICEF, and some special day webinars. And we really welcome all of you to share your ideas, suggestions, learnings, so that we can profile what you are doing. We also are really grateful to Kiesi for the French language, en français, but we see that there's really a need to expand into different languages, and we're exploring ways to do this. And if this is something you're an expert in, please do reach out to us. And then importantly, we're here to profile all of you, our prize winners, getting exciting profile today, and will be profiled all over the next year. We will do more blogs, put out their films, they will be in the ANA journal. But we also know that many of you are doing unsung hero jobs, and we would love to be able to profile you more, for example, in the podcast that Mbozo is the voice of. So if you go to the next slide. These are just two areas where we're trying to move forward to implement together. So one is these user action pathways, taking simplified practical steps to take things that maybe we lose sometimes. For example, pain management in neonates could be seen as a luxury, and yet it's utterly foundational to quality of care for babies and for families. Kangaroo mother care, which many of us are passionate about. How do we do better? How do we do more hours? How do we start it earlier? How do we do it for babies who aren't stable? And we welcome your ideas and offers also for other pathways. Then we have this very exciting map that Lauren alluded to. She actually won a Dragon's Den competition to fund this. And we'll have an exciting webinar on the 3rd of December, where we will look at some of these studies, look at how to do better on implementation research and how to democratize that. So thank you, and I pass now back to the wonderful Dr. Olufunke Bolaji, who's going to help us with some conversations with our fabulous winners. Back to you, Olufunke, and thank you, everybody.
Thank you very much, Joy. Thank you for giving us all that delightful information about what the new year is going to be and what our Africa Cup of Nations is going to look like. Thank you. Okay, so we're really looking forward to some time with our winners and asking a few questions. I don't know who wants to take the lead. Israel, I know you may need to translate. But what was the core message from your winning essay? If any of our winners could unmute and speak. Tasmin, are you there?
Yes, I'm here. So
Great.
my core message, like I said in my video, was that I have a very unique perspective, being that I am a parent of a Premie, and I work in an organization that focuses on prematurity. So I have a unique perspective in that I actually bridge the gap between the healthcare workers and the parents. And I wanted that to come across in the essay, to know that our parents want to be involved. They don't want to be visitors. They don't want to be sidelined. We want to have the ability to be parents, but to also fully understand what is going on with our small and sick newborns, and being able to carry it on outside of the NICU, because that's the thing. It's something I've noticed within our context, is that we are having a lot of losses post-discharge, and I feel it's because of lack of education to our parents in a manner in which they can understand. And like I had said, our NICU team, I think they were amazing. They were advanced already in knowing the importance of having us be involved. And I promise you, it made the world of difference. My baby got discharged sooner than expected, and I was able to go home confident in knowing what to do should something happen. Because I had done all the care myself, basically, while we were still in the NICU. And that's what I wanted to share in the essay. I love what the toolkit has to offer. I was well aware of the toolkit, but I took a deep dive in while I was doing my essay, and I was blown away at what is in that toolkit. And I was even surprised to see my fellow South Africans have some information involved in there. So it was really amazing. And I think we have to just spread the word of this toolkit to everybody and anybody. Thank you.
Thank you, Tasmin. Your use of the toolkit really showed through in your essay. And it was amazing because a parent was able to give us such a fantastic essay, not the academic point of view, but bringing the confidence that a parent develops being at the center of care. That's shown through really well in your essay. Thank you so much, Tasmin. Israel, are you up now? Can we listen to your call message from the essay?
Please feel free to speak in French, and I think we have a translation possibility as well.
Thank you, Alex.
Merci beaucoup pour cette opportunité que vous m'accordez. Quand j'ai entendu pour la première fois ce qu'est la boîte à outils, c'était l'année passée lors du Next Partners Meeting qui s'est tenu ici à Ngozi. J'ai pas participé à à cette édition-là, mais je me suis dit peut-être cette année, je voulais partager mes idées avec des autres chargés de suivi des nouveau-nés prématurés de faible poids sur le thème de mettre la famille au centre des soins. En passant, je parle de quelque chose qui se passe quand on parle, par exemple, des soins kangourous, même si c'est un peu en dehors. Lors des formations que nous organisons en tant que formateurs sur les soins kangourous, si tu poses la question aux participants, ils te disent est-ce que impliquer la mère, c'est de l'aide ou c'est une surcharge pour toi? Et qu'est-ce qu'ils répondent? Ils disent que non, moi, je ne peux pas avoir le temps de surveiller l'enfant et la maman en même temps. Mais malheureusement, ils oublient que en éduquant la maman à bien maîtriser les soins kangourous, ça aide aussi le personnel à gagner plus de temps, mais aussi à mettre directement la mère au centre des soins. Moi, mon essai, c'était par rapport à l'éducation des parents. Est-ce que les parents, la famille, connaissent leur rôle dans la prise en charge des nouveau-nés? S'ils ne sont pas conscients qu'ils ont un rôle important et non d'être des spectateurs, si je peux dire ça comme ça, d'être des témoins de ce que font le personnel infirmier. Il faut commencer d'abord à les conscientiser, les donner les outils nécessaires, donc de dire pour le bien-être du nouveau-né, on n'a pas seulement besoin de néonatologie bien équipée, on n'a pas besoin des infirmiers qualifiés, des médecins néonatologues pédiatres qualifiés. On a besoin de l'implication de la mère au premier rang. L'exemple que j'ai donné, c'était par rapport au sommeil du nouveau-né. Si la maman ne sait pas que le sommeil du nouveau-né est quelque chose important parce que, comme nous, il a besoin du temps de sommeil, du temps d'éveil. Et si la maman ne sait pas que c'est très important que l'enfant se repose, et elle ne peut pas nous dire que l'enfant, peut-être, ça fait une heure qu'il vient de s'endormir, alors qu'il a besoin au minimum 90 minutes. S'il y a des activités qui peuvent être reportées, et ils peuvent être reportés en fonction de son sommeil. Mais pour arriver à ça, il faut que nous, en tant que personnel, soyons conscients de cette implication de la famille, de la mère, du père en général, mais aussi essayer de tout faire pour ramener la maman à son rôle je dirais, de premier rang dans la prise en charge du nouveau-né prématuré ou de petit pot ou du nouveau-né malade. Bon, j'ai utilisé une phrase que j'aimerais peut-être partager aux autres. Je dis, on peut avoir la néonatologie la mieux équipée du monde et avec tout le matériel, mais sans l'intervention, l'implication de la maman, on ne parlera jamais, ou les soins centrés de la famille seront toujours des mots sans impact, sans importance, sans poids dans la prise en charge des nouveau-nés. Je vous remercie beaucoup.
Merci beaucoup. Félicitations, Israel. And I can see we're getting close to the end, but I don't know if Emmanuel or Christina or Ophelia is able to tell us briefly about your submission, the key points.
Yes, thank you very much. So in the name of my team, we thank you all for this great opportunity, and we're happy to be with all the other winners here and to learn from each other. So our focus is really, because we have started this journey 8 years ago, so we really wanted to understand what do parents, families need, and who even does belong to this family, because we know especially in the African society, it's not only parents, but it's the larger community that helps to bring up small or sick newborns. So over time, we really came up with this approach that it's not just during in the postnatal phase, but it's really the continuum of care that should be at the focus of our work. So we start actually during pregnancy, intrapartum, and also in the postnatal period that we want to support and work together with families. So we did research together with families, but also healthcare providers, to get both perspectives of what they need and what challenges they have. And we came up, or we are currently working on to come up with a family systems care program, so that we can really assess who belongs to the family, who they want to be involved when they're pregnant and then going through labor and then the postnatal phase. And we really want to, with this systemic approach, we really want to assess who belongs to the family, what support they need, and that can only be done if we can build relationships between healthcare professionals and family members. And this relationship and trust is really needed so that we can provide families with appropriate, effective intervention and support measures that are tailored to the needs of these families, because what we healthcare providers sometimes think might not be suitable for these families. So this is really our goal, and to support these families so that they can go through better symptom and everyday management when they go through challenging times. And with this family systemic approach, we can really strengthen the communication between healthcare providers and families, but also within the families themselves, and also soften the suffering of these families. And it's an ongoing journey, and we really want to connect the different levels of care, also from hospital, community, and home care. And I have to also would like to use this opportunity also to thank all of you for selecting also our essay to be among the winners, and to my great team in Ghana, my supervisors in Ghana and Switzerland. And such a work is only possible with such an amazing team, and we're really honored to be here. Thank you very much.
Ain't that the truth? And congratulations to your whole team. Apologies from my co-host, Olafunke. She has lost internet in Nigeria, so I'm afraid you're stuck with me for the last few slides. We do have some upcoming webinars. I think you saw them on the last slide, but we also have some very important conferences next year. The Council of International Neonatal Nurses is having their annual conference in Africa, in Zambia. I think that is August 14 and 15. And then a week later, the African Neonatal Association is having its inaugural conference in Kigali, Rwanda. So put those dates in your diary. You can also at least find the ANA details on our website. And I think that's not quite it. We have a few more exciting announcements, and this is an exciting one. And this is very real. So with huge thanks to Kiezi Foundation, the African Neonatal Association is very proud and happy to say that we are starting to disperse some small research grants. And these are for African researchers working in Africa. Just $1,000, but I think many of us on this call know $1,000 can go a long way, and can be the difference between success and failure. What I must stress is that the closing date for this is very soon. I think it is, I think it's in about a week.
On the 17th. World Prematurity Day.
It's on the World Prematurity Day, of course it is. So go to the African Neonatal Association website. You can just Google African Neonatal Association, you'll find it. The details are there. Please apply. We've only just announced this. You've got a good chance of winning, and we want to support African solutions to African problems. But that's enough me singing about the African Neonatal Association. I think that is pretty much it. We are on time. Olafunke, what do you got to say for yourself?
Okay, so we are going faster and we are learning together. So as we close this webinar, fantastic webinar, I think we've had a great time today. We've heard from all our 3 winners of the essay. We've learned what's upcoming next year. We've learned about our conferences that are coming. We've learned about our podcast that will be on next year. So I want to say a big thank you to everyone who has joined in. Thank you to our speakers. And we will definitely have a recording of this shared on all our social media channels. And that's all from Alex and me. We hand over to Mbozo to close this for us. Thank you.
Thank you, Mbozo.
Thank you so much for everyone joining. You see on the screen now QR codes to our newsletter. And thank you to our funders of the Nest 360 Alliance, funders of the French Toolkit, the Toolkit EAT, the expert advisory team, and the Toolkit team based at London School of Hygiene and Tropical Medicine. Thank you so much, and see you all at the next webinar.
Fantastic. A bientôt. Merci beaucoup.